Musculocutaneous nerve. Musculocutaneous nerve is a branch of lateral cord of brachial plexus. The root value is C5, C6 and C7. Musculocutaneous nerve supplies the muscles of anterior compartment of arm like the biceps brachii, brachialis and coracobrachialis. So the muscles of anterior compartment of arm are supplied by musculocutaneous nerve. Brachialis actually has a dual nerve supply. The lateral part is supplied by radial nerve and a medial part supplied by musculocutaneous nerve. Musculocutaneous nerve also gives rise to lateral cutaneous nerve of forearm, which supplies skin over the lateral aspect of forearm. So as the name suggests, musculocutaneous nerve, the muscular part supplies the muscles of anterior compartment of arm and the cutaneous part supplies the skin over the lateral aspect of forearm through the lateral cutaneous nerve of forearm. Now look at this question here. A patient who met with a road traffic accident has swelling and injuries around his right shoulder. The patient has inability to flex his elbow and the forearm is pronated. A nerve injury is suspected. Which other finding can be seen in this patient? Will there be loss of abduction of shoulder, loss of extension of wrist, loss of sensation on lateral aspect of arm or loss of sensation on lateral aspect of forearm? So look at the question here. A patient who met with road traffic accident and injuries around his right shoulder has inability to flex his elbow. So which muscles are responsible for flexion of elbow? I hope you remember biceps brachii and brachialis are chief flexors of the elbow and the forearm is pronated as well. So that means supination is not happening properly. Which muscle can assist in supination? I hope you remember the biceps brachii is also a chief supinator. So thus from this question we understand that there is some problem in the movement of biceps brachii. So which nerve supplies biceps brachii? I hope you know the nerve supply of biceps brachii is musculocutaneous nerve. Now with this concept, let's look what would happen along with the loss of flexion and a loss of supination in the patient if there is damage to musculocutaneous nerve. Loss of abduction of shoulder? No. Abduction that is mainly caused by deltoid is supplied by axillary nerve. Loss of extension of wrist? No. Extension of wrist or the wrist extensors are supplied by radial nerve. Loss of sensation on the lateral aspect of arm? No. Musculocutaneous nerve actually gives rise to lateral cutaneous nerve of forearm. So the correct answer should be D. The patient will be expected to have loss of sensation on the lateral aspect of forearm. The lateral cutaneous nerve of forearm is a branch of musculocutaneous nerve.